Welcome and good afternoon and good morning to everybody. We're going to get started in just a minute, just giving everyone time to hop on. Great, thank you all so much for joining us today. We're really excited to kick off this session on accreditation. We are going to have some great presentations and informative sessions today, and we're so happy that you're able to join us in this afternoon or morning, depending on where you're joining us from. I wanted to welcome you all to Accreditation Preparation and Best Practices, the Accreditation Association for Ambulatory Healthcare, also known as the AAAHC. This session is a little longer than 1 hour in length. We will have a little extra time for Q&A, and it represents the second session in our series on accreditation. We will have sessions following this that focus on CARF and NCQA accreditation processes as well. We also had an overview session that happened a couple weeks ago that is available on our website. But I wanted to get us started this afternoon by saying hello. My name is Emily Baer. I am a Public Health Associate in the Technical Assistance Division here at NCUI, and I will be the host for today's session. We can go to the next slide. Many of you are probably familiar with NCUI and our mission already, but we are the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. We strive here to improve the health of the over 70% of the American Indian and Alaska Native population that lives in urban areas and support their quality, accessible healthcare centers. Next slide. Thank you. So I just wanted to go over a few guidelines as we start. A couple notes to keep in mind are that the webinar is being recorded and all mics are muted on entry unless it's directed to ask a question or engage with the speakers. We do ask that you turn your camera on because it allows for better interaction and engagement, but we understand that's not always possible. It is, as I mentioned, slightly longer than 1 hour, so 1 hour and 15 minutes. Questions can be typed into the chat box, and there's further instruction on that in a minute. And there's going to be a Q&A session featuring all the speakers at the end of the session. Slides and recording for this and previous sessions are all available at the link displayed, so just ncui.org/accreditation. So to ask a question or comment, you can, in Zoom, if you're not as familiar with this platform, you can just select chat on the black toolbar at the bottom of your Zoom screen. And then merely type your question or comment into the chat box and it will appear on the right. We will be monitoring the chat box throughout this. And if you have any questions during the session, we invite you to enter them and we will keep track and make sure that they get answered in our question and answer section. We also ask, as you enter the room, if you would enter your name, tribal affiliation, and organization in the chat box so we can all introduce ourselves, that would be awesome. Thank you. I wanted to mention as we do that, that we also have a survey at the end of the session, which is a great opportunity for you to be able to let us know how we can serve you better. It's just a place, it's a pretty short survey, it's just a place for you to suggest further topics or ways that we can improve our sessions for you. And thank you and welcome to everybody who is entering their names in the chat box right now. Hi, everyone. I will add the survey link as well, so you can just keep that up if you would like. As I mentioned, this is the second session on the AAAHC, the second session in our series. And we are going to get started in just a minute. If we go to the next slide. We will have two presentations. The first is featuring Mona Sweeney, who will speak about the IHS and AAAHC. And then Brian Robles will lead us through the actual UIO site visit process using his experience at Native Health. After that, we will have a 50-minute Q&A and time for the survey and upcoming events. And then we will conclude our session. Next slide. So I'm super excited to introduce our presenters today. Mona and Ryan are wonderful. It's been great to work with them developing the session for you, and I know it's going to be amazing to hear from their experience, wealth of experience, and years of practice with the AAAHC. Mona is the Assistant Director of Business Development at Indian Health Services Contract Project Manager. She has been serving in this role since 2018 and previously was serving as the Assistant Director for Accreditation Services since 2012. She's actively involved in the development, education, implementation, and promotion of the primary care and medical home programs. Her role here is as project manager for AAAHC contracts to include HRSA's accreditation and PCMH recognition initiative, as well as the Indian Health Service, Urban Indian Health, and Federal Bureau of Prisons. She has created and delivered the content and programs for numerous webinars and on-site workshops, and many of you may be very familiar with Mona already through your own AAAHC accreditation processes. Brian Robles has been employed at Native Health for over 6 years, and he has been the quality and risk manager since 2019. Before that, he was working in both medical and community health and wellness capacities. Brian has provided valuable input and continues to move the agency to improved levels of quality and safety, and was instrumental in Native Health's response to COVID-19 by providing a structured outline to pandemic response and policy to inform those decisions as well as strategies for vaccine distribution. He recently led the agency to its 5th AAAHC reaccreditation with PCMDH recognition. Brian has a Master of Public Health degree from the University of Arizona and has lived in Arizona since 1997. And prior to that, he was living in Guatemala. Brian joins us today from Native Health and will be leading us through many best practices for UIO site visits with AAAHC. So please join me in welcoming both of our wonderful presenters, and I am going to hand it off to Mona to get us started today.
Thank you, Emily, and appreciate your introduction. Like many of you, we all wear many hats, and so I'd just like to start by saying thank you for your service and all you all do individually for your organizations, particularly through all of the challenges that you faced for this last year. Not to say that there weren't challenges before. So I think taking things to another level, we've all been tested and tried, and yet at the same time, we're keeping our focus on also quality improvement. So just attending the session, I know there's over 40 of you participating today. Thank you for your interest. It's a team project and it's a team effort, and I think the result, as many of you have experienced, is something that benefits your patients as well as your own organization. So with that, next slide. So what I'd like to hope to accomplish today is to give you just a little bit overview to understand why choose accreditation.
It's not actually.
Sorry? Can you mute your mics, please? Okay, so what I'd like to do is just provide you a little overview from my perspective, what I get feedback as to what the benefits of achieving accreditation, and more importantly, our focus on maintaining accreditation through the cycle of your accreditation. Also want to educate you a little bit about what the Indian Health Service contract offerings are for your organizations. We accredit over 6,000 organizations, and the contract provides additional technical support help ensure successful maintenance and accreditation. So I'm excited to share some of those things with you. I'm going to touch lightly on the review of the accreditation process, since I know Brian's going to delve more into that. And then just kind of give you an overview, as people ask me often, how long does this whole thing take? We're interested, but we don't know how long it's going to take. So I'm going to answer some of those questions and any others you might have. Next slide, please. Okay, that's not the entire picture. That's funny. It's not. Oh, there it comes slowly. Okay. Um, it's not showing the logo. Well, I'm just going to speak to this. Oh, here it comes. Sorry, must be just technical difficulties here. So AAAHC is moving forward after 40 years as a leader in ambulatory accreditation, and we're trying to build on our experience with a philosophy and a vision to be a driving force for the transformation of ambulatory healthcare by advancing quality through evidence-based standards. It's something that we're taking to that next level, to really challenging ourselves as to saying, why are we asking this? What is the evidence and why is it important? And I think that's something that you'll see philosophically about us. We're not prescriptive. We are when we need to be, but we're looking to create and set standards that are meaningful to your organization. So we're looking to be an interactive learning and provided by expert guidance. Our immediate focus is going to change, though, the conversation from getting ready for the accreditation, because your patients depend on you to be survey ready all 1095 days, which is the number of days in an accreditation term and not your tax return. Our voice is going to be communicated continually through our 1095 strong. That's our new branding, quality everyday philosophy, and has been embraced by many of our loyal clients already. And I hope that it's going to resonate with you as well. Next slide. As I mentioned, we've accredited over 6,100 organizations. We are private, independent, not-for-profit. Our program is very peer-based, and we're proud to be a partner with the Indian Health Service as a contractor. Next slide. I'll talk a lot about the fact that we really want to have this philosophy that sort of permeates our process and drives really what we do. So that to me helps answer the question as to why choose AAAHC accreditation. Came up with this just because I want to stress that we want to be partners in the process. We're not inspectors of products, of your facility, or anything like that. We want to join with you to get on that journey for quality improvement. We really do stress that we're consultative, and we hope that the experience is interactive and dynamic, that allows your organization to participate and generate discussions, ideas, and solutions. So it's sort of that starting point where we come in and see where things are. We're going to validate the quality care you already provide. We know the Indian Health Service has been functioning at a higher level, particularly when it comes to medical home, because of the philosophy of your tribes to take care of your families and your communities. And I think because of that, we really are proud of the fact that we continue to, even within the pandemic, look to try to see that, especially with medical home, at the point of care that is being delivered. Is what's on paper is not necessarily the same as what's translated when you come to see something on site, or you miss things because it's only on paper. Our standards really, as I mentioned, provide a framework for your program design. So if you're an organization that has not been through any type of accreditation and you're not sure where you're at, or you're starting a new site or what have you, it really gives you that basis to see what you need to have in place to continue to thrive as a promoter of quality and safety. Our reports will give you your centers a big picture view of where you're at. And I think the process, I see this as a big communicator to us too, is that the programs facilitate staff and patient engagement. It can't be just the QI person's responsibility to get you through this whole process. It really is sort of the basis of philosophy of work, and that is when you engage people, have them participate, see the reason why behind you're doing something, the chances of that continued quality improvement goes up significantly because you get everybody engaged, and it's something that you can then promote to your patients as a success. And I just want to reiterate in terms of our partnering, our survey is agreed upon, the date is agreed upon through you and us. It's a joint venture. It's not a surprise. And that really is a point that reflects our philosophy, because we want what you want, and we want that experience to be engaged as well. And so if in fact your CMO is on leave at the time we've surprised you with the visit, that really is not, a value. And of course the CMO is one person, but what if it's the quality or even the staff itself? So we really want to make sure that people can avail themselves of the experience and participate in the process. Next slide. So some of this is part of what we receive feedback from our own organizations that have gone through accreditation. I just want to reiterate that our survey is all in one for medical home, because when we think of medical home, it really is customer service at a high end in a medical community. If you were looking to improve the quality, engage patients, and to get outcomes that you want, we know now that medical home is the model that is set up to increase that potential success, with the relationship and access and comprehensiveness and continuity of care. So I think we're not going to look at you as to be accredited and then separately look to see if you're functioning as a medical home. It's an all-in-one. And I think, just nationally, when we talk about medical home, we're not even using that terminology as much anymore. It's called advanced primary care. And what I say to patients is it's the care that you want. It's at that higher level. A couple other benefits. So the written report I mentioned before is a framework. It's a blueprint for your continued improvement. You'll see consultative comments as well as ratings in terms of how you've measured against the standards, and it's something that you'll continue your transformation, especially with medical home, after we leave. And so that's why we're promoting that 1095 strong, really carry on. Benefits also include the tools and the consultative advice that you're going to have to improve your business operations. Again, those comments will be listed separately, and they're for your value as you see fit. You do not have to implement the consultative comments, but they are a result of the experience of the surveyors having been to other like organizations, and they are suggestions for your own option. It really does, as I mentioned before, provide staff development in terms of the process. Patients' assurance of quality care. There's nothing better than to be able to say that this accreditation assures you that we are at the same level of care as some big medical group practice or some other type of organization, one of the 6,000 that we accredit. It's also patient-facing recognition, particularly when we're coming out to see you, and the fact that we engage with the patients as part of the interview. So it really is something that is a value, or felt as a value. And again, I think competitive distinction within the marketplace, it really is something that is pride, elicits pride within a community and organization, and certainly recruiting of staff and faculty to work alongside with your organizations to know that there has been somebody that's come in to do an evaluation. Next slide, please. So I mentioned that our approach and the philosophy is one of more discovery and not inspection. We're not there to catch you at something to get the findings, but to really honor and acknowledge where you're at and identify those areas for improvement. Talk about being consultative. We're prescriptive when we need to be, but we are also looking to ask you how you are serving your patients. And we do understand that there are differences in cultural understandings and things that you will incorporate into how you provide care. So that is something that we look for. And again, we're collaborative and not punitive. We have over 300 surveyors nationwide. They are our eyes and ears of our organization. They're professionally, actively involved and experienced ambulatory healthcare. They are mentored and trained. They have to be privileged in order to survey community health and Indian health services. They go through intercycling training. They have to be reappointed every 2 years. And we have the standards training and education committee that provides oversight. So there's a lot of interaction between our organization and the surveyors. Next slide. This point, I just like to introduce the new core for the Indian Health Contract for Urban Indian Health. Debbie and I have met a couple times in the last weeks. She's replacing Shannon Beyale. And I think even Shannon might be on the call today. So I do have to say a shout out to Urban Indian Health. Working with the cores have been really a huge assistance to our organization to understand your particular needs, but also I think they've been a major support to members of your organization. And so with that, I thought I'd introduce Debbie and for her to say a few words. Debbie?
Yes, good morning, good afternoon, everyone. As Mona said, my name is Debbie Norwood. I just want to do a really quick introduction. I am an enrolled member of the Navajo Nation. I'm from a small community south of Ganado called White Mountains, Arizona. I just wanted to share with you, so I recently started at headquarters with Office of Urban Indian Health, and as a health system specialist. And I, as Mona said, I will be providing some oversight and coordination for the contract. I want to let you know that I've worked for the IHS in various capacities over the, I don't know, 15 plus years. But more recently, I worked at a 65-bed hospital at Northern Navajo Medical Center and participated in their recent Joint Commission survey in 2019. And one of the kind of experiences I've had is they also got their certification for the PCMH, the patient-centered care. And I guess now the new word is the advanced primary care, as Mona stated. So I'm very excited to be working with you all. If there are any questions, please direct them to me. If I don't know them, I definitely have a good relationship with Mona, and that, you know, her and I will figure this out, and we'll go through this together. Thank you.
Thank you, Debbie. I appreciate you sharing a little bit about your background and how accessible, and I have to reiterate, very accessible. We talk quite frequently, and any issues or anything that comes up. In fact, the process is, next slide, please. So let me just start with the contract. We have negotiated with the IHS discounts for your organizations to participate under the contract to get discounted rates for to cover fees for application, accreditation, reaccreditation. Not only a mock survey, you'll see on the next slide, there's also an opportunity to have a conference call to review a gap analysis, and I'll talk about that in a minute. We have toolkits and handbooks, obviously, that are at discounted rates that you have access to order. And I really have to reiterate this Achieving Accreditation seminar. We just wrapped up one actually Monday, Tuesday, Wednesday, and we had an inordinate number of, happily, of organizations registered. So I'm very anxious to get feedback from you all to see what you think of those presentations. Actually, it's not even too late to register. You are able to register and view because we've archived things for 30 days. I think everything's available till April 16th. So if you missed attending the live and you're still interested, you can contact Debbie and or myself, and we'll get you the information to get registered to attend and review the slides. It's a 3-day, Monday, Tuesday, Wednesday sessions that cover a lot of focus on quality. It focuses on our standards and other areas that are pertinent to your organization. So there's still a chance to do that. Next slide. So pre-survey options, as I mentioned, the gap analysis that wasn't listed out as a CLIN, but it is something that's an option. So you're going to do a gap analysis just when you get ready. You're looking at the handbook. What do we need to do to comply? Where are we at now? And what do we need to fix? If in fact you want some additional assistance, you could actually submit your analysis, which really we have all the standards in Excel, and you would write yourself as if you were the surveyor doing your own mock survey. And then of course that's an attestation. So we are taking you at your word, and we can conduct a phone call for 2 hours with the surveyor and myself, and we'll talk about those areas that you don't feel that you're compliant with. And we can give you some ideas, suggestions, and links and things to, to carry on and get you ready for that preparation. Additionally, and after that, you could also request a mock survey. And both of these are really tools that a lot of organizations who are going through an initial survey will access. Those of you going through your accreditation, unless you're new to the role, you're familiar with our process, the standards get updated and you're up to snuff with what's going on. You may not necessarily need to have that. But again, it's there for organizations who would like that additional reassurance and direction prior to a survey. We do have archived webinars. I will tell you that I think the webinars that are available for that month after the Achieving Accreditation are much more up to date. Archive does mean that they're not necessarily out of date, but they're not as up to currency as our Achievement Accreditation conferences. But that's again something you might look at that list to see what you can access. And again, those are available for within the period of performance of the contract. So if you've had access prior and it was a different task order year, which ends in September, then you'll have to ask for new access. And of course, there'll be updated slides in that as well. Next slide, please. A lot of educational resources within the contract and outside of the contract. You might see the little icon up at the top right, Learn 1095 Strong. That is the brand and portal for our organization's learning and development education sessions. So there are webinars in there that once you have assigned for Achievement Accreditation, you would access that portal, and that is how you would get to our training as well as the archived webinars. We produce a newsletter called Triangle Times. And yearly, we provide a outlook, a quality roadmap, if you will, that'll give you some insight as to how our primary care organizations are doing by segment and in comparison. So I think that's always a good reference. But also the toolkits, and if you've had toolkits before, you'll see that they've been updated and look a little different, but just wanted to give you a sense of what those are. And I do want to just point out the toolkits are not for patients. They are toolkits for you and your staff that give you directions and review of white papers and things, best practices related to a certain area and topic. Any questions, I can happily answer that in the future. Next slide. So let's talk a little bit about what it all takes to get ready. I think organizations that have not gone through the process before will reach out to me and say, gosh, when should we start? How long is it going to take? And while we are, I will answer that question. The question just popped up. Sorry, I need to remove that for myself. I think it differs from organization to organization based upon what they have in place. And I always talk about it in terms of the areas that take a lot of time, if you will, of course, doing your quality studies, because that's something you measure over a period of performance, something that you review, and then you might have to remeasure after you've implemented some changes. So that takes time, and you have to take that in consideration. Conducting drills, we require 4 drills a year, and that gets spaced out over time. One has to be a CPR drill. So again, that is something that might take some time. Probably the top item is looking to see what all the required written documentation needs to be. And we'll talk a little bit about that in terms of reviewing the handbook. There's generally, as an overview, you start with reaching out to Debbie, letting her know that you're interested in one of those CLINs, getting started, survey fee, application, wherever you're at, and she will then contact me, and we will get we'll get the situation started. Of course, the gap analysis, you start that as soon as you get the handbook. That varies from client to client, just depends upon how long, and that's the process that I think Brian will be talking about. So I'll let him focus on that because he has that experience from the health center perspective as to how long that takes. But again, in terms of sequentially, the next thing, of course, is any, technical assistance and preparing your application, submitting that. You have to get some documents that I'll review in a minute, and the final prep. So generally speaking, 8 months to a year, just depending upon the organization's readiness, and can be as early as 5 months. Next slide. I want to stress again, being partners in the process, this is an open book review. And to that end, we provide not only, of course, the standards themselves, that is what you will be reviewed against, but also the tools. I mentioned the written requirements, the documentation that starts on page 175 to 193 after the tools section in the handbook of the V41 that's being shown here, but also the worksheets that the surveyors are going to use on site. So you can, on your own, in fact, make sure you do your own mock surveys if you have additional satellites to see where they're at. And again, we also have, you'll see on the next slide, as I mentioned, the worksheets include privileging, credentialing, clinical records, personnel, and what I should add to that is the satellite worksheet. And the satellite worksheet covers all the standards that your satellite is going to be reviewed against. So that's a good one to hand out to those satellites to get a checklist going in terms of where they're at as you do your mock survey. Featured on the right here, the visual pictures are a process of our quality improvement studies. If you're doing PDSA, not a problem. We are not prescriptive. We're looking for you to meet the elements that are required for a good quality study, and I think that's pretty universal. So if it's written up in a PDSA format, that is fine, but take your study and look at it against the 10 elements and see if you can check, because that's what the surveyor will be doing. They'll check to see if you have those, the specific elements that we're looking for in that standard and chapter. Next slide. So we talked about the gap analysis, the phone call, the pre-survey call, or mock survey, or just getting ready on your own. The next slide, the next step is your application. Next slide. You'll get a code or get access on our website to activate your application, and it's on our first page. There's 2 places to go into, but this is just a visual to see that you go online to our website, and it'll give you application for accreditation, which is the first one. Next slide. So what we're going to see is when you get into your application is a list of all of the requirements and where you're at in your application process. It'll show that you have 9 sections to work on, and each has to be 100% before the application is considered complete and before we can schedule anything. This is a dashboard that shows how complete you are for each of the sections. We also suggest that applications for recreds come at least 5 months prior to the desired survey date. And I think now with COVID, it's when you know you're up, get started as early as you can. We want to make sure that the document is quote unquote live, and in that you won't have to have any changes between the time you have your application and the survey. We know who should complete the application is whoever is the point of contact, somebody who's knowledgeable, a representative of your organization, and typically it's the primary survey contact. You complete this at your convenience. It does not need to be completed all at once. You can save it and come back to it. And then there are a list of required documents that need to be provided. And you'll see that you have to remember to hit the submit button in order to get to the next step. So what are some, next slide, please. So what do you need to submit? It's information for the facility to be accredited. We have provide the contact info for everybody. If they're the same, or they'll need to enter the same person in each section. Primary contact person is the one who receives all the correspondence regarding the application and the survey. And this is where you designate who's going to get the decision letter, where it needs to be sent. Under the contract, a copy of the decision letter and the report also goes to the core as part of the contract. We're looking for you to provide us information about the size of your organization, what services are being offered. Also, what type of anesthesia is provided if you have any dental practices. And again, we're looking just to see where you're at so we know how to scope your service, scope the survey for your actual survey. Next slide. The next part is scheduling. Once you've submitted your application, you might hear from the account manager who's going to review it and ask you questions for things that might be missing. And scheduling, next slide, please. The process of scheduling, this is why the application is really important, is we need to pair your organization with true peers. So we want to make sure we know what services you provide. We want to know how large your organization is so we know how many days we'll be surveying, how many surveyors we'll need, and what privileges that they require. During COVID, we've gone 2 ways. We certainly will reach out and ask you for what days you would like to be surveyed, but we will also, the preferred dates, but we'll also ask you for blackout dates. And that's because we're really looking to make sure that we can schedule your survey with available surveyors, and with the number of backlog we've had from the COVID times, we have to work things from 2 different angles. You will receive notice from our scheduler about the surveyors, who they're going to be, and you'll get written confirmation. Next slide. I think Brian's going to be talking about this, so I'll just show this as an overview. We're looking for you 4 weeks prior to get the packet. There's a notice for accreditation, and the purpose of this is we want you to hang that in all your facilities, all your satellites, to give patients the opportunity to reach out to you or to us and to say we'd like to speak to the accreditors when they come. That doesn't happen that often, but it is an opportunity for patients to be involved and to provide feedback as well. So we require a 30-day posting if in fact your you know, 2 weeks prior to the survey, just hang it for 30 days. And I know Brian will talk about that as well. Again, the surveyor will contact you a week or so before, and they're going to talk to you, get to know your organization a little bit. They will have reviewed your documents and give you a little overview of how they're going to conduct the survey. And we look for you to have an area for them to work in. Obviously, the way that we're going to be reviewing you is documentation review, inspection, and interviews of organizations. So that's observation and interviews and interviewing the staff. We're really looking to not disrupt your day, so they may very well schedule some of the interviews at certain times so people can kind of come in and out, if you will, but we're looking to engage in your organization's staff to be participants and provide comments when, you know, one way or the other. Someone doesn't know the answer to something, that's not an issue. We need to know that they know who would know where to go for that information. So again, we'd like to be interactive. Next slide. On-site survey. Next slide. So again, we talked about sort of the timeline of that. Surveys are anywhere from 1 day to 3 days, 2-3 surveyors, depending upon how large your organization is. And we really start out the day with an opening conference. It's an opportunity for your organization, if you'd like to create an agenda and provide a little overview and history of your organization. Again, there's a lot of, you know, pride in our getting to know your organization and to feel that we're partners in this process. So that is a real good opportunity for board members to be there, to share in some of that experience. They will do record review. They'll do a facility tour. And they need, so for the arrival piece, and also, of course, they need a workspace where they can come and go and work together and have privacy to make comparisons, because if they have different surveyors might go to different satellites and they're reviewing different chapters, and so then they get together to see if in fact the findings are consistent within your other satellites. And I mentioned reviewing, they're going to review policies and procedures, conduct interviews and files, and follow a patient if it's a medical home. Observe a dental procedure if in fact you have that as a service. And then at the end of all of the conferencing, there is a summation conference. And that is another opportunity for you to have a space to include as many people, and we're doing a lot more virtual now, and that's an opportunity too, if you're going to record this or if you're going to have it streaming, let the staff know, our surveyors know ahead of time at the beginning of the survey, and you can include those so that they can hear really what the findings have been. And it's a overview. It's not an end all be all of everything, because our surveyors, they're the eyes and ears. They provide the recommendations to an accreditation committee who make the final decision. And what I like about that is, instead of their being the ones to render the decision, it just provides that one level of arm's length opportunity to partner with your organization. I've actually seen on survey where we've met with the quality director and reviewed a quality study, and we had a couple questions about the data analysis, which she was able to answer quite readily. And the surveyor just said, you know what, I'm here till tomorrow. If you can incorporate that into this report, into your quality study, that's what I'll submit as a final submission. And that makes a big difference. It's not like, let me review it, let me give you a grade and check, up, you're missing something and we're end all be all. We really want improvement, and there's nothing to be gained just to point out something that is wrong, but to provide that ability to provide corrections, even on site, is pretty, I think, remarkable. Next slide. I mentioned talking about having a specific time, because it really is an opportunity to get as much of your staff involved as possible, and really hearing it from the surveyors. I think there's another opportunity where you'll get a report and then you'll have an internal meeting, and so then, you know, whoever the quality director or whatnot shares what the findings were from the survey team from AAAHC. I think hearing some of it from us also makes a difference to you know, to highlight where they see some of the strengths, but they'll also highlight some of the things that are going to be evident that might need some correction. It's also an opportunity to ask questions and clarify. You know, if you feel that there's something that isn't clear, you know, these are all 300 individual humans who come from different levels of experience. And if in fact you're not in agreement, this is your opportunity to say, can you please share with me where that standard is asking for something in particular, because I think sometimes it may not be clear if it's consultative or a requirement of the standard. And so that's something that allows you to provide that clarification. Again, it gives you an opportunity to provide any other items that they might have missed or that need to be included. And as I mentioned, provide clarification and discuss anything that you might disagree with. Next slide. Plan of correction. We do expect all of our organizations to take these reports and continue the work once we've left. It's not something that you put on the shelf and then you pull out prior to the next survey, because surveyors will be looking at that, and Brian will be talking about that. Next slide, please. So we work with Medicare in the ASC world, and they require plans of correction immediately. Anything that's in jeopardy has to be taken care of, and we're taking it back to the plan of correction. We're taking that to that next level and going to provide an opportunity to learn a little bit about what we think in terms of what an implementation of a successful plan of correction would be. So this is a webinar. It's not part of the contract, but take a peek. If you're interested, you can register. And so you wouldn't have to, contact Debbie for that. We can move on. So apparently we don't want to stick on the slides, so that's okay. Decision. Next slide. I know we say on average the decision comes across for 30 days. It's been a little bit higher recently because of COVID and getting all of the reports reviewed and approved by the Accreditation Committee. They're the ones that make the final decision. 3-year term. If in fact there's something that requires us to come back before that, you might have an interim survey. And certainly non-accreditation is a possibility. And yet I really have yet to see that happen in my 9 years here. It has happened, but again, it's something that I'm proud of, to say that we do a lot to help organizations to get ready. And of course, the certificate of accreditation, but I'll add that you'll also get a separate certificate for each satellite that's a medical home, or it's been designated as a medical home, and it'll reflect the fact you have accreditation with medical home. Next slide. So your team is beyond me. It's myself, as well as Deborah Edelman, who is the manager. She has been there for many years, I think 7 years, and is very knowledgeable about the contract. Next slide. Eliana is one of the account managers who oversees primary care, and Grace is somebody that you'll become intimately involved with. She's been phenomenal and helps magically get these surveys scheduled, the dates that you want, and the surveyor's availability. And with that, next slide. So that's sort of a quick overview summary, and I think I'm going to let Brian to dive deeper into the specifics as far as how, from the perspective of a health center going through accreditation, what does it take? I had the privilege of meeting Brian back in 2019 at one of our Achieving Accreditations, and appreciate that his commitment and attention to all of this and passion for quality improvement. So with that, I will turn it over to Brian. Thank you.
Thank you, Mona. Thank you for that introduction. Thank you, Emily, for that introduction as well. Good morning, good afternoon, everybody. My name is Brian, and I'm going to be going over some of the best practices for AAAHC. Next slide, please. So as you know, AAAHC develops standards to advance and to promote patient safety, quality of care, and value for ambulatory healthcare through peer-based accreditation processes, education, and research. So here at Native Health, we comply with all the core chapters plus additional adjunct chapters that you'll see here in a moment. And then through AAAHC, the agency is designed designated standards to integrate, monitor, and improve quality of healthcare, increase patient staff and safety in health centers, increase marketability of health center services within the community, and then provides a means for, like Mona said before, recognition through PCMH or PCMDH, which is a patient-centered medical and dental home. Keep in mind that accreditation is not the same thing as certification. AAAHC does offer a 3-year specialty program certification. So for example, the Advanced Orthopedic Certification Program, but accreditation is looking at the agency as a whole. Next slide, please. So these are the list of core chapters as well as the adjunct chapters. The core chapters you'll see on your left-hand side, and everybody who's looking for accreditation through AAAHC will need to look over these particular chapters. The ones on the right-hand side are the adjunct chapters, and those apply if you're providing any of those kinds of services. Here at Native Health, you'll see all the ones with the check marks. Those are the ones that we were reviewed on because we provide those services at any of our 3 locations. Next slide, please. So what do the timelines look like in regards to application for survey? So prior to scheduling a survey, your agencies will submit the application for survey that includes all accredited sites. Mona was kind enough to give you an oversight of what that looks like. Generally, it's recommended that you submit your application at least 5 months prior to the accreditation dates that you have in mind. But sooner rather than later is always better. For first-time applicants, you will want consistent input from your senior management team, and this goes from the very beginning of application for survey all the way through the very end, which we'll see in a minute. Senior management team and their guidance is really important in making sure that your AAAHC accreditation process goes as smoothly as possible. And then you want to designate 1 or 2 main points of contact for information gathering and submission. In our case, it was the health services administrator and myself as the quality manager. One tip I have for you guys is if you have a date range for accreditation in mind prior to submitting your application, you want to ensure that there's no future conflicts. So if you're looking at having, say, for example, your accreditation sometime in May, you want to make sure that as an organization, your senior management team is available, that you don't have any kind of pre-planned events that would hinder your ability to all be there at the same time. So it's really important to look ahead as much as you can. Next slide, please. So how do you get ready for an accreditation? First and foremost, you want to form a multidisciplinary team. So this includes a wide range of individuals, whether it be department directors, administrative staff who will have a hand in making sure that your accreditation process goes as smoothly as possible. You want to form that team early and start meeting right away. You want to also familiarize yourself with the accreditation handbook, which again, Mona has talked about before. And she did make a good point in saying that this is really an open book test. If you've got an accreditation handbook available to you and you can, all the information is there. All the information you need to make this accreditation process a success is there. You want to determine and familiarize yourself with that, and particularly with the chapters that will be applicable to you. You want to begin to meet as a team as early as possible to determine what the responsibility distribution is going to look like, what the appropriate timeframes are going to look like for application, for accreditation, and then as well as consultant assistance, which we'll talk about in a minute. You want to also maintain detailed notes throughout the entire process. And this is just to help you keep track of everything that's going on. This is, if you have a large organization, and even with small organizations, it's a very detailed process. It takes a long time. You have to check a lot of boxes, and you want to make sure that everything that you're doing is up to par. And so you want to have good detailed notes to fall back on if there's any questions or comments from any of your staff along the way. While it's not required, it is highly recommended that you hire an outside consultant to perform a mock survey. I think this, at least for us, this was a very, very pivotal moment in determining where we were as an organization in the readiness for a survey. This is what we did was we had a retired surveyor come out and do the mock survey himself. And he was able to give us some very, very good feedback as to areas to improve, some consultative information, things that we maybe were aware of, but maybe didn't necessarily know how to fix them. So really, really important. And I know that Mona has talked about this as an opportunity for all UIOs. So take advantage of it, definitely. Next slide, please. So visit all of your sites, visit all of your departments, and do so consistently and do so often. You want to have walkthroughs. You want to look at what's available when you do your walkthroughs. If there's anything that sticks out, anything that is not up to code, you want to make sure that you correct those as you do your walkthroughs. Update all your contact information. Anything that's on the wall for patients to see is really important that you get everything up to date. You want to ensure that all your policies, all your procedures, your bylaws are up to date. The AAAHC requires them to be updated on an annual basis. And most importantly, and I think this is something that the surveyors are going to talk about a lot, is that make sure that the practices that are being done on your site reflect what is actually happening. So in other words, are we actually following our policies and procedures as we have them written down? They're going to be looking at these policies and procedures as a guide, as a framework to your actual practice. So if your practice does not correlate with your policies and procedures, then there may be some findings there. You want to ensure strong documentation throughout. You want to make sure that your governance and any other standing committees have good documentation. You want to make sure that all of your staff trainings are well documented, in particular, any kind of trainings that are done on an as-needed basis, or any kind that are targeted to specific individuals like back office medical, etc. You want your facility inspections and testings to be readily available because they will be asking for that information. You want your incident reporting to be on point and available, as well as any medical protocols that are currently in place, say, for example, due to COVID-19 and such. You want as well your state certification and your CLIA waivers to be up to date as well. And throughout this whole process, you want to make sure that you keep your board of directors, or at least your senior management staff, in the loop regarding how the preparation process is going, any hiccups, any additional assistance that you might need while you're going through this process. Next slide, please. So prior to review, Mona's already given a detailed view of the communications, the open communications between the site and the surveyors and AAAHC. So keep in mind that this is a very open line of communication, and you'll have an opportunity to set your dates. But once you've set your dates for review, the main surveyor will contact the agency for steps to take prior to their arrival. So it may be one surveyor or it may be multiple. In our case, it was 2 different surveyors. Again, due to COVID-19, modifications may need to be made, but you agree upon those modifications with your surveyor prior to the site review. The site may need to discuss logistics of review with surveyors, things like when we're going to start the survey, when we're going to end for the day, any kind of transportation for the surveyors that is involved in any kind of meal times and stop times for breaks. Next slide, please. So some of the modifications that that occurred due to COVID-19. So due to the pandemic, AAAHC surveyors will generally request PPE be made available to them upon their arrival. They may already come with PPE on their person, but it's always important to have that available to them before they arrive. They'll require to complete a readiness checklist for every site, focusing on disaster preparedness and infection control and prevention. And this is directly related to the COVID-19 pandemic, as well as a limited number of individuals may attend the opening and closing in person. So what we did was we had a very small group of individuals attend in person along with the surveyors, and everybody else was doing it through teleconferencing like we're doing today. The same way is with chapter reviews. So once you start going into the individual chapters reviews, you may limit it to a single person or an additional individual along with the surveyor. And then everybody else would be teleconferencing, particularly those who are at different sites. With that though, there are things that do not change. The first is in-person site walkthroughs and reviews. So the surveyors will want to walk through the entire facility, make sure that they're doing that in person. They'll want to look at those medical or dental procedures in person. And they'll want to do patient interviews if they get a chance to. We did have our surveyor have an opportunity to talk with a couple of patients at our sites and ask them questions about what our level of care looks like. So those things don't change. The surveyors will still want to go into the back office, med rooms, and things like that to make sure that we are in compliance with all of the applicable requirements. Next slide, please. Other preparation activities, you want to ensure, like Mona says, that there's a sign at each of our at each site at least 30 days prior, and it's clearly visible stating the accreditation dates for patients to see. You know, if you put them at the front entrance of the building or anywhere that's clearly visible, that's always a good place to put them, and make sure that they're at every site that is going to be reviewed. While you may be meeting on a weekly or bi-weekly basis at the beginning with your senior management staff, it's important that as we get closer to the survey date that you start doing so a bit more consistently, maybe twice a week if need be. The more you meet, the better I feel is going to be for the organization once the day comes for review. And again, you want to designate 1 or 2 individuals who will be your main points of contacts throughout the review. So I was one of those individuals who anybody could call on at any moment if they had any questions or concerns during their individual chapter reviews. You want to discuss with surveyors how they may interact with employees during all staff meetings. So if you meet as an organization periodically, like we do once a quarter, that's a great opportunity to review with your entire staff what an accreditation process and review looks like, so that everybody in your organization is aware of when those dates are going to be, what kind of expectations you have for the particular individuals, and what kind of questions and resources they may have once those dates come. You also want to create a reference guide. Well, this is not necessary, but we created a reference guide to assist employees during review, just a little half sheet, kind of like a cheat sheet, just so everybody's comfortable with answering any kinds of questions that a surveyor may have. And then lastly, you want to finalize the schedule for the review. So you'll have a schedule of when everybody's expected to be a part of a particular chapter. And that's generally agreed upon with the surveyor. Next slide, please. So the day of. So depending on the size of your organization, review is scheduled roughly for anywhere between 2 to 5 days. If I remember correctly, our survey was scheduled for 4 days, and we had 3 different sites. You want to do one final run through for questions or comments from staff prior to the beginning of the day. So we got there fairly early. We did our run through, just any last minute questions from our front office staff. And then we got to doing the review. Like I said, plan to have key members attend in person during chapter reviews. Everybody else can do so virtually. And have all your documentation ready. Make sure you know where everything is located, and you'll have a pretty good idea once you go through the handbook what the reviewers will be looking at during specific chapters. Keep in mind the schedule is a guide, but you may want to deviate from it when needed. So certain chapters may be shorter, certain chapters may be longer. There may be a focus that the reviewers may want to focus on a little bit more deeper. So just keep in mind that the schedule may be a little bit flexible as you go throughout your day. Next slide, please. So after review, surveyors may want to continue requesting documents afterwards. So we actually had a couple of requests because there was a lot of information to look over, and some clarifying questions from surveyors, and maybe a document here and there. But keep in mind that surveyors want to, it's not a gotcha game. It's very much a collaborative process. So if they feel like they know you have documents, you just weren't able to produce them right then and there, they'll definitely give you that wiggle room to do so. Your agency will receive a preliminary review document that includes any kinds of deficiencies that were noted. And with that, a corrective action plan submission will be required for areas that were not fully compliant prior to your final decision. So you'll get a document with preliminary findings, and your responsibility with the rest of the senior management team will be to determine what kind of corrective actions you're going to take, and then you'll send those back to your surveyor. After everything has been submitted to the surveyors, they then will turn and submit all documentation for AAAHC for final decision. And your main point of contact will receive a decision letter anywhere between 4 to 6 weeks or more, depending on various factors. As Mona states, COVID-19 really had an impact on all aspects of the logistics when it comes to this. So it may be a little bit longer, but expected around that time. Next slide. Well, so a few recommendations after accreditation. Continue to monitor your corrective action items submitted to AAAHC or any kinds of findings. You want to upkeep areas where you did well, and especially when there's staff turnover, because that presents itself as an area where it could fall under your performance measures if you do have new staff coming in. Surveyors definitely pay attention to previous deficiencies. So if you are due for reaccreditation, one of the first things they'll look at your previous report, and they'll look at your previous deficiencies to see what kind of corrective actions you've made, or if you've had any kind of improvement. And lastly, you want to make AAAHC review a regular point of discussion at your meetings and your standing committees, at your board meetings, to make sure that we are up to date and we're keeping track of all of the corrective actions, and that we're on track to make those corrections sooner rather than later. And then next slide. And that is it for me.
Thank you so much, Brian. Thank you, Mona. Those were very illustrative presentations, and I am no expert on accreditation, but I feel like I'm one step further through that process. Thank you very much for sharing with us. We're aware we're a couple minutes over, but we still have plenty of time for questions. So I do want to invite everybody. If you do have questions for Mona, Brian, or Debbie, who is going to be on hand for questions as well, to please place them in the chat box, and I would be happy to read them out.
I just wanted to make a clarification. I know our plan of correction processes, actually, we're looking to improve things and move forward. At this point, I don't necessarily think, I think under one of the contracts, there was a POC like under HRSA, you may very well get that where you have to submit it back to us. But at this time, it's a requirement and a standard for all organizations to work on it, but it's not something that you'll submit back to the surveyors. And maybe you had that experience, but that would be a one-off thing. So we're looking to continue to, as I mentioned, maintain that philosophy of 1095. I was even thinking, Brian, it's great advice that you've provided, because I've actually worked with organizations saying, we're up for reaccreditation. I'm new in the position and I've never seen the report from the last time. And, to me, it is a blueprint. It's like you said, if anything, make it, I love that tidbit, make it a part of your quarterly discussions, keep it top of mind. Where are we at? Maybe you have chapter champions that you might want to on a particular quality, meeting. Let's talk about chapter 7. How are we doing in infection prevention? What strides have we made? Or certainly the quality chapter itself, or, even clinical records, pharmacy, what have you. So I think it's great. It becomes a lot easier if it just becomes part and enmeshed within your own, process and how you look at things.
Yeah, thank you for clarifying that, Mona. I know that our organization was a little bit different in that regard, but yeah, thank you for that.
Yep.
And I just wanted to address a question we had earlier from Linda about accessing the archived webinars you mentioned, Mona.
Yeah, any of the CLINs, any of the technical assistants, reach out to Debbie, and she will then forward that request on to me, so we get that formal, connection there, and we'll invoice for that particular CLIN. And once we receive payment, you'll have access. And I know that, Linda, your organization is up in June. I would strongly suggest considering accessing the achievement accreditation that we just submitted, because that's a much more fulsome. You can pick and choose which chapters you want to look at. We have a limited library of webinars that are in the archive. You're more than welcome to those as well. So some of it might be redundant with what we've provided in the achieving accreditation. But either way, any of the CLINs, definitely just reach out to Debbie, and then we'll get that processed for you.
Thank you, Mona. And Linda, you can feel free to unmute if you do have any follow-up questions at all.
Thank you, Mona. I appreciate that. I did get the email, so I will reach out and request that access code to the resources. I did have one more question. I understand that in the past, our policies and procedures plans should be in place at least 6 months prior to a survey. And with COVID-19, we've been updating policies, plans kind of all along in the past year as the situation changes. Is that acceptable?
Yeah, we're looking to see, is it on your agenda for the board approval? I mean, where are you in the process, and what is your organization following? Granted, like you said, with COVID, you're in a position to be creating new policies reflective of what you're dealing with. I think particularly with COVID, a lot of things can fall under existing policies that you have in place. But if you have anything additional, we're not going to look for how long that policy is in place. We're looking to see that it's been written, that it's been approved by the board, or it's on the agenda for approval, and that you're following it. And just to that point, I wanted to mention that whatever your policies say, that's what we're going to come out to look and review. If your policy is more stringent than our standard, let's say credentialing, you're going to say every year, or every 6 months, and we say every year, we're going to review to be every 6 months, because like Brian said, we're coming out to ask you what you do, to see if you're doing what you say you're doing. And that is, relevant by policies, by observation, and by action.
Thank you, Mona.
I'm not seeing any other questions in the chat box yet. I did want to add that if you're more comfortable asking your question by unmuting, you can do that. I would say if that is better for you, then please just raise your hand or type that in the chat box so we can call on you. It could get a little hectic if everyone unmutes at once. But yeah, I just wanted to offer that option as well.
Well, we're hoping that this is a conversation starter and not a one-off. So, the slides have my contact information. Feel free to reach out to me directly. Happy to, or any member of my team. Certainly, Brian, what a fabulous resource you are for these organizations, having lived it yourself. And we really would love to have the opportunity to work with you and join you on your mission transformation for medical home and quality improvement and safety.
Definitely. Yeah, I think, particularly with, questions relating to preparation process, definitely reach out to me if you guys have any questions. Phone or email is always great. And I'm here as a resource, and so is Mona. And one of the things I always keep in mind is, even though we just finished our reaccreditation back in October, it's always something that we'll be consistently looking at, and how can we improve it for our next reaccreditation. So always looking ahead.
Well, I think we're going to start wrapping up, but I think we all really appreciate how open you both are to receiving any questions after this. Like you said, Mona, it's definitely a conversation starter, and some of questions that might come up are definitely not just easily answered in a quick Q&A after a webinar. So that's appreciated. And the slides will be available along with the recording in a follow-up email to everyone. So you will be able to access all the contact information for all of our presenters, as well as the recording if you want to go back and review any of the information.
I would suggest, if you're even considering and not sure, reach out to Debbie and ask to have a accreditation handbook. To me, our handbook speaks for itself, and it'll give you an opportunity to kind of go through and see, is this something that we can do? It'll just be very clear in terms of where you're at. You can do a little self-assessment, use it as a guide as you develop your own programs. That's a good start. You don't have to do the whole thing. Just get a hold of the handbook and reach out to Debbie, and we can, through the contract, get one to you.
That's a great point. Thank you, Mona. I think we're going to go to wrap up, so we'll go to the next slide. I just wanted to alert everyone to a few upcoming events. We are fully in the swing of virtual learning events at this point, I'm sure, as you all know. So we do have our Project First Line event coming up on March 30th. So that would cover hand hygiene. And then we also have our third session for this accreditation series, which is on the Commission on Accreditation of Rehabilitation Facilities, or CARF, which is on April 8th. And then we have the third and concluding session for our Promoting Mental Wellness series, titled Weaving Calm, a Strength-Based Approach to Addressing Stress Among Urban Native Youth During COVID-19. That is at the end of April. So we are hoping you'll be able to join us in the future for those events as well. Next slide. We have a conference at the end of May as well, which will be entirely virtual, and more information will be coming forward on that soon. Next slide. And as a final reminder, we really appreciate your feedback. We're all learning with these virtual events on how to improve them and make them more useful and engaging for all of us and for anyone who is also presenting. We really appreciate your feedback just on the topics and even any kind of structure to the session overall. So if you do have the time, we really would love if you could fill out some of the survey that's in the chat box. Thank you. And going to the next slide, I just want to conclude this afternoon's session by thanking our wonderful presenters, Brian and Mona, as well as Debbie, for being on hand to answer any questions and introducing herself as the point of contact for this at the IHS. So we really appreciate your experience, especially all of your tips and strategies for performing the accreditation process, and your openness, Mona and Brian and Debbie, to answer any questions in the future. Thank you all for joining us today. We're so grateful you were able to take the afternoon or morning to learn with us, and we hope to see you in the future. Thank you, everyone. Have a wonderful day.